Hi, my name is Jacob.
Hi, my name is Chad.
And we're both nurses, and we're here today to talk about fevers and temperature taking and to ensure that you can safely manage a fever at home.
So why might you have an elevated temperature or a fever? The most common reason why someone would have a high temperature or a fever is because of some sort of underlying infection. The body increases its temperature in order to inactivate the bacteria or viruses that have found itself into the body.
There are 4 common methods to taking a temperature. The first method is the oral method, which is through the mouth. The second method is the axillary method, which is using the armpit. The third method is the tympanic method, which uses the ear. The last method, which will not be covered in this video, is the rectal method, because recent research has shown that there's an increased risk of injury using the rectal temperature when it is not completed by a healthcare provider. Thermometers come in various shapes and sizes. Here are 2 examples of thermometers that we use here in the hospital. Regardless of the thermometer you have, prior to using it, you should always reference the owner's manual. This ensures that you're selecting the proper settings and that you're selecting the proper temperature measurements, as thermometers can come in 2 temperature measurements, degrees Celsius and degrees Fahrenheit. Although they are equivalent, they will provide you different numbers on your display screen. So just ensure that you are aware of the proper measurement you are using. For the sake of this video, we will review temperatures in degrees Celsius.
When choosing a method to taking someone's temperature, please follow these guidelines. As a side note, the rectal temperature is the most accurate measurement for those from birth to 5 years old, but as you're likely doing this at home, please follow the following guidelines. From birth to 2 years old, the first choice is through the armpit. From age 2 to 5 years old, the first choice is by the ear or the armpit. And lastly, for 6 years and older, including adults, the first choice is by mouth, and the second choice is either by the ear or the armpit.
We will now review how to properly take an oral temperature, also known as a temperature taken by mouth. You will grab your thermometer. Many thermometers have a setting for either oral or axillary. Ensure that you select the proper setting for the proper method in which you wish to use. The end of the thermometer will be placed underneath the tongue, and the lips will be closed around the thermometer. We will now review how to properly take an axillary temperature, also known as an armpit temperature. First, start by selecting the proper setting on your thermometer by selecting the axillary temperature setting. Insert the probe in between the armpit and the arm and close the arm firmly. We will now review how to take a tympanic or ear temperature. Whenever you are taking a tympanic temperature, it is important that you do not provide excessive pressure on the thermometer into the ear canal. Once minimal resistance is met, you should stop pushing. This is to prevent injury to the inner ear. We will now review how to take a tympanic temperature on a patient who is under the age of 3. You'll grab your thermometer, select the proper setting. You'll then reach and grab the tip of the ear, pulling back and down. Now insert the thermometer, press the register button, and then it is complete. We will now review how to properly take a tympanic temperature in a person 3 years old and up. First, start by selecting the proper setting on your thermometer. Place one hand on the tip of the ear and pull up and back. You insert the thermometer and press the register button. We will now discuss the normal temperature ranges using the different methods exemplified prior. For adults and children over the age of 1, a normal tympanic temperature is 36.5 to 38 degrees Celsius. A normal oral temperature is 36.5 to 37.5 degrees Celsius. A normal axillary temperature or armpit temperature is 36 to 37.3 degrees Celsius. For infants aged 0 to 1 year old, the only appropriate methods for obtaining a temperature are axillary and rectal. We will not be covering rectal temperatures in this video. A normal axillary or armpit temperature for an infant aged 0 to 1 year old is 36.5 to 37.3 degrees Celsius. Someone is considered to have a fever if their temperature exceeds the upper range of the measures showed on the screen before you. For example, if an adult measures an oral temperature of 38.2 degrees Celsius, they are considered to have a fever. There are a few medications that you can take to safely reduce your fever. These include acetaminophen, also known as Tylenol, and ibuprofen, also known as Advil or Motrin. Tylenol is the gold standard for reducing fevers and should be your first choice. Ibuprofen is also appropriate, but should only be taken if you or your child are drinking enough fluids, since this allows the ibuprofen to be properly processed by the kidneys and excreted. It is discouraged to alternate between acetaminophen and ibuprofen, as this has been found to not be any more effective and can actually increase the likelihood of overdose. To properly dose these medications, follow the instructions on the bottle or on the box. For pediatrics or children, it is important that the child be weighed first, as many of the doses are calculated based on weight. Never exceed the maximum dose of Tylenol or ibuprofen to reduce a fever. This can cause irreversible and potentially fatal damage to kidneys and to the liver. There are also other measures you can take when managing a fever. You should monitor the temperature of you or your child every 2 to 3 hours to search for improvements or a worsening fever. You can monitor you or your child for other symptoms. You can dress in lighter clothing to allow yourself or your child to cool off. You can even bathe in lukewarm water or apply lukewarm water to a washcloth, which can then be placed on the forehead. Both of these can help cool off you or your child. It is very important to continue to drink fluids when you have a fever so as to prevent dehydration.
You should go to the doctors or any sort of healthcare facility if you have a fever and any of the following: chest pain or pressure, shortness of breath while resting, coughing up bloody sputum or bloody spit, if you're wheezing or having difficulty breathing, if you are drowsy, disoriented, or confused, if you have extreme pain in your ear, and if your fever is greater than 39 degrees Celsius that lasts more than 4 days, or is getting worse. You should bring your child or your kid to the doctors or any sort of healthcare facility if they have a fever in any of the following. If they're under 6 months old and have a fever, if they're dehydrated. If you're dehydrated, they'll likely have dark urine, a dry mouth, and will not be producing any tears or drool. If they've had a fever for more than 6 days. If they're older than 6 months and have a fever of greater than 39.5 degrees Celsius. If they're really sleepy or have low energy. If they're really cranky, restless, or irritable. If they have a cough that will not go away or stop. And if they have a rash.
So we thank you for learning more about fevers and the management of fevers in the home, and we hope that this video is useful.
Thank you.